Okay, the second project which I'll quickly touch upon is a large program like National TB Elimination Program. How much of ever of us like to criticize the government? Sure, that has it, fallbacks and gaps, surely. But to run a program for 1.5 billion people is never easy. That's the Indian population, and TB is a large challenge, especially even for private sector today, because we have TB which is now cannot be tackled by even antibiotics, antibiotic resistant TB. And some of the things what we use in COVID, like the gene expert for doing the diagnosis, is also used in TB. So very quickly, I'll run down, and we have used Gen AI here also for the people who are looking at IT and the new buzzwords of using, machine learning and artificial intelligence here. So I'll quickly get down. So first things first, we got down to upskilling ASHA workers here, or community health workers, CHWs as we are calling them, to look at the screening and vulnerable cases in that community. So this is a pilot example. So outreach was done to basically take a understanding that if someone is having a prolonged cough, fever, history of TB, or in contact with a person of known TB, that is taken down, that data is taken. The population is said that our mobile medical unit will visit your area, will talk to you. We didn't, it was not put as TB van because TB has a stigma in India. So it was just like your health van or health checkup van. We spoke to people, went down there. It had a digital X-ray. The digital X-ray, the good thing is you can do your algorithms, or if the X-ray reader is not there, you can use a machine learning algorithm on that to predict if this lung will have TB or likely to have TB. Some of the vans also had gene experts, or the machine which has sputum analysis, because in TB you require both sputum as well as your chest X-ray to confirm. In most of the cases, in many cases, one is good enough, and sometimes you require both. So both was put. Then for faster screening, we wanted to do this. This was a wish list at that point in time. So because in a lot of places, hilly areas especially, radiologists are not available. We don't have radiology technicians or your MD radiologists who are available in that area. So your AI can help you, you can say out of 10,000 X-rays, bring it down to 900, 800 X-rays, which are actually could have TB. So that is where you can actually leverage technology to improve turnaround times. After that, you know that this person is having TB, sputum positive, X-ray positive, or other positive case history also adds to it. Then you put positive patients on the National TB Elimination Program. You register them. There's a Nikshay vertical which has a digital records of all the patients enrolled by the government of India. You put them on that portal. You have local monitoring done by the ASHA workers, whether they're taking their class line 1 and line 2 drugs for tuberculosis. And then we do the community outreach for spreading awareness that no, people should not get TB, and also the follow up, because this is where digital technology, a chatbot, can help, because these drugs have huge severe side effects, from your urine getting red to itching to nausea, vomiting, and then people get scared and they stop the medication. So this is a time where you can offer support, offer correct advice. And obviously you and me cannot be physically present with each patient each time, but if we have a chatbot repository that can really help them pacify their symptoms or bring them to ease. So this is where that technology again can be leveraged and used. For continuous monitoring, you require to take X-ray again of the lungs to see the improvement. So again, every 6 to 9 months, you require for a follow-up with the patient. Again, AI can be used to look at improvement. Compare first X-ray to X-ray 2, X-ray 3, and the AI can predict whether improvement is happening. So again, you can reduce human workload and use technology here. Lastly, obviously, like I said, behavioral change campaigns, lifestyle modifications, counseling, other things for a long-term support to the patient. Last but not the least, a very industry specific use case from patient support program. If those who are from the pharma or medtech industry know that a lot of patients or companies have patient support programs. Patients who are enrolled on their therapy, let's say cancer therapy or therapy for any other drug, like you can say your multiple sclerosis, take let's take an example, where you require that the patient not only requires your drug but also requires help with counseling, diet, physiotherapy, right? So if you are asking the patient to pay a premium on the drug, you should also offer this support. So these are the ways in which you offer that. So a PSP is an operations heavy thing, which is run by a PSP partner, typically IT provider or another company, right, which helps with information on the drug with the dedicated websites, have all these things from product queries to your dietitians, counselors, or etc., who you can reach out to over the phone. You have an assessment called done. And also if you are looking at insurance or some kind of subsidized costing for the drug, then your financials can be submitted and they can make a case for you that okay, you are eligible for that. So a PSP or a patient support program is again an operations heavy scenario where you have daily patients coming in, daily queries coming in, and where if you have your principals or operations management, you can play a beautiful role. It's again a very opened up sector, or demand is increasing in India.